I'm going to start off by verifying my order and verifying my hospital policy. Then I would do hand hygiene. Then I identify my patient using two identifiers. I'm going to go Jaguar J. Jones, date of birth 8/25/63, date of birth 8/25/63. I'd also check the allergies on the MAR and at the bedside. I got penicillin and penicillin. And I provide as much patient privacy as possible. Now I'm going to assess the site and palpate it through the dressing, looking for any signs and symptoms of complications. Okay, now I would move my bedside table close to the side where the central line is, and I would keep it at waist level for sterility purposes. I would put my supplies on a flat, clean surface, and I would also position my trash can near me. Alright, now I'm going to do hand hygiene again. Now I'm going to position my patient for comfort, raise the bed to a comfortable working height, lower a side rail, elevate the head slightly. Then I am going to remove my sterile kit from the packaging and open the first flap, exposing the mask. I'm going to put on my own mask and my goggles. Assist the patient putting on their mask. And I'm going to remove my mask for recording purposes. Alright, now I'm going to don my clean gloves, Now that I've put on my clean gloves, now I'm going to remove the old dressing. I'm going to do this by stabilizing the catheter with one hand and pulling the dressing towards the insertion site on all sides. Now I'm going to remove that old dressing once it's all pulled to the center. Now I'm going to assess the catheter, the insertion site, and the surrounding skin for any signs and symptoms of complications. This is also when I obtain a culture if indicated. Now that I've removed the dressing and assessed, I'm going to remove this dressing inside of my glove, going glove to glove and skin to skin. Hand hygiene. Now I'm going to open up my sterile field. I'm going to be mindful of the 1-inch border, and anything hanging off my table is now contaminated. I'm going to remove my sterile gloves. And don my sterile gloves. Alright, when I don these sterile gloves, I'm going to go on the inside of the first cuff to don the first one. I'm going to abduct the thumb and go outside of the cuff on the second one. Now that I've got them both on, I can adjust as needed. Alright, now that I've donned my sterile gloves, now I'm going to organize the equipment inside of my sterile field, being mindful of the 1-inch border. Now I'm going to clean the site, starting with the alcohol swab. I'm going to clean it by by going in a circular motion around, starting on the inside, working my way out, being sure not to clean any one place more than once. Going to dispose at waist level. Now I'm going to clean it using the chlorhexidine applicator swab. I'm going to activate it by clicking the sides. Now I'm going to hold this to lift this line to clean up under it. This hand is now contaminated. Going to clean the catheter itself vertically and horizontally. Clean it vigorously. Then I'm going to clean the surrounding site, going horizontal and vertically. I'm going to clean it for at least 30 seconds. After I have cleaned it, I'm going to allow it to completely dry. And this is also, now after it is completely dried, now I'm going to apply my BioPatch. When applying my BioPatch, I'm going to ensure that I do not touch the actual skin itself after I have cleaned it. Now that my BioPatch is applied, now I can apply my new Tegaderm. When I apply this Tegaderm, I'm going to make sure I'm only touching the borders, not to touch on the inside. I'm going to make sure I apply it smoothly. Making sure that all the edges adhere to the skin properly. I'm going to do this by following it around as I take off the outside, the outside layer. Okay, once I have applied the Tegaderm, now I'm going to dispose of my sterile gloves, going glove to glove and skin to skin. Going to remove my own mask and my goggles, my patient's mask, perform hand hygiene. Now I'm going to do the date and time on the new dressing. I would write date, time, and my initials and apply it to the side of the dressing itself. Okay, now that I've did date, time, and initials, now I'm going to lower the bed back down to a safe height, raise a side rail, position my patient for comfort, make sure the call light is in reach. Going to discard of all of my equipment. After I've discarded all of my equipment, I'm going to do hand hygiene again, and I am going to document. I'm going to document the appearance of the skin, the insertion site, the catheter. I'm going to document any drainage, the amount, characteristics, if there was a culture obtained. I'm going to document the type of cleanser that was used, document the type of dressing that was used, and I'm going to document the how well the patient tolerated the procedure. And I would also do date, time, and my own signature on my notes.